Listen closely because this can change what happens next. If you are over 45 or you care about someone who is, there is one mistake that changes everything about stroke risk, waiting for the warning to become obvious. That is the trap. Stroke rarely arrives like lightning from a clear sky. More often, the body whispers first. Tiny interruptions, strange sensations, brief failures that last minutes, sometimes only moments, and then disappear. And that is exactly why people ignore them. They think it passed, so I'm fine. But sometimes it passed because the blood vessel reopened temporarily, not because the danger disappeared. I am Dr. Kevin, and after more than 20 years working with adults facing cardiovascular and neurological risk, I can tell you something directly. The body often rehearses before the real emergency arrives. Doctors call these events transient ischemic attacks or TIAs. They are short, temporary, and extremely dangerous precisely because they fool people into delay. Think of it like a warning light on the dashboard of a car. The engine still runs, the vehicle still moves, but something underneath has already begun failing. And if the driver ignores that warning long enough, the next stop may become permanent. Before we talk about the specific warning signs, you need to understand the pattern behind them. Stroke does not usually appear out of nowhere. In most cases, the blood vessels feeding the brain have been under attack for years. High blood pressure damages the vessel wall, elevated blood sugar scratches the inner lining like sandpaper. Smoking inflames and thickens the blood, cholesterol plaque slowly narrows the arteries, irregular heart rhythms create unstable circulation. All of this happens silently in the background while the person continues living normally. Then one day, circulation drops just enough in the wrong area of the brain, and symptoms suddenly appear. The reason early warning signs matter so much is because there is often a very small window to stop the next event from becoming catastrophic. Sometimes that window lasts only hours, sometimes a couple of days, but once brain tissue loses oxygen for too long, damage becomes permanent. That is why speed matters so much with stroke. The earlier the warning is recognized, the greater the chance of preventing severe injury. The first warning sign people frequently dismiss is temporary vision loss in one eye, not both eyes. One eye, people describe it differently depending on the exact blood vessel involved. Some say it feels like a gray curtain sliding downward. Others describe fog, shadow, darkness, or a blank area appearing suddenly in part of the visual field. Then, just as quickly, it clears. And because it clears, the person convinces themselves it could not have been serious. But temporary vision loss in one eye is often one of the clearest vascular warning signs the brain can produce. A tiny clot or narrowed artery may briefly reduce blood flow to the eye or the visual pathways connected to the brain. Then circulation partially returns, allowing vision to normalize again, but the problem underneath remains. If this ever happens, look at the clock immediately. Notice which eye was affected. How long did it last? Was it complete darkness or partial dimming? Those details matter enormously when physicians attempt to identify where blood flow became compromised. The danger is not only the symptom itself, the danger is assuming temporary means harmless. The second warning sign is sudden numbness or weakness on one side of the body, not gradual stiffness, not soreness after exercise, sudden weakness. One arm suddenly feels heavy, one side of the face feels strange, one leg no longer trusts the ground properly. This is the symptom many people explain away as a pinched nerve, poor sleep, position, or fatigue. Sometimes it truly is harmless, but when the change appears abruptly, especially involving the face and arm together on one side, you must think about the brain first. Stroke symptoms usually follow clean neurological patterns because each side of the brain controls the opposite side of the body. That's why one-sided changes matter so much. Here's a practical test doctors often use. Try smiling. Does one side of the face droop? Raise both arms forward. Does one drift downward? Can both hands grip equally? If one side suddenly refuses to cooperate normally, do not wait to see what happens. Fast evaluation changes outcomes dramatically with stroke risk. The third warning sign is sudden loss of coordination or balance. People often describe this as feeling drunk without drinking. The room may tilt unexpectedly. Walking suddenly feels uncertain. One leg misses steps. The body drifts sideways. Reaching for objects becomes inaccurate. This symptom becomes especially dangerous because People frequently blame inner ear problems, exhaustion, dehydration, or low blood pressure. But when coordination changes arrive abruptly and without explanation, circulation to the brain must be considered. Certain regions of the brain control balance, eye movement, posture, and coordinated motion. Even brief interruptions in blood flow can create dramatic changes in stability. Sometimes the person themselves notices immediately. Other times family members notice first because the person begins holding furniture, taking tiny cautious steps, or moving strangely. And yes, these episodes can be subtle. Someone may simply say, "I feel off," but sudden neurological changes deserve attention even when they appear mild. The brain often whispers before it screams. The fourth warning sign involves speech. This is one of the most visible and frightening symptoms because other people often notice it first. Speech may become slurred, words become tangled, simple sentences suddenly feel difficult to form. Sometimes the person knows exactly what they want to say but cannot connect the words correctly. Other times they hear language normally but struggle to understand meaning. These changes often last only minutes during a TIA, which unfortunately convinces people they are safe once normal speech returns. But temporary speech disruption is one of the strongest indicators that blood flow to language processing areas of the brain has become unstable. If speech suddenly sounds thick, delayed, confused, or incorrect, treat it as a medical event, not exhaustion or stress. One of the subtle patterns physicians watch for is unusual pauses or incorrect word substitutions. A person may answer simple questions strangely or lose track of normal conversation flow. Small changes matter because they often represent early vascular compromise before larger injury occurs. Now let's discuss a warning sign most people would never associate with stroke risk at all: new severe headaches in the context of autoimmune disease. Conditions like vitiligo indicate that the immune system is capable of attacking the body's own tissues. In some individuals, autoimmune activity and blood vessel inflammation can overlap. That does not mean every person with vitiligo faces stroke danger. Absolutely not. But when unusual neurological symptoms appear alongside a dramatic change in headache pattern, especially after age 45, it deserves medical attention rather than dismissal. The key concept is pattern change. A normal recurring headache that has remained identical for years is very different from sudden severe headaches appearing with numbness, weakness, balance loss, or visual symptoms. The body often signals vascular inflammation through combinations of symptoms rather than isolated events. That is why physicians look at patterns, not single sensations in isolation. Now let's slow down and look deeper at the actual vessel damage happening underneath these warnings. High blood sugar is one of the most destructive long-term forces affecting circulation. Excess glucose damages the delicate inner lining of arteries day after day. Imagine sandpaper constantly scraping the inside of a pipe. Over time, the smooth vessel wall becomes inflamed and irregular, making clot formation easier and narrowing more likely. Smoking accelerates this process dramatically. It irritates vessel walls, increases inflammation, thickens blood, and reduces oxygen delivery. Hypertension adds another layer of injury by constantly forcing high pressure against already damaged arteries. Then there are rhythm problems like atrial fibrillation, where unstable heartbeats allow blood clots to form inside the heart before traveling toward the brain. Stroke is rarely caused by one single problem. Usually it is the final result of multiple years of accumulated vascular injury finally reaching a breaking point. One detail many people never realize is that stroke does not always occur during the highest blood pressure reading. Sometimes the event happens when pressure suddenly drops, especially overnight. Imagine an artery already narrowed by plaque, blood flow barely reaches certain brain tissue under normal conditions. Then blood pressure falls during sleep, circulation dips slightly lower, and suddenly that fragile area no longer receives enough oxygen. This is one reason some people wake up with stroke symptoms already in progress. The circulation was unstable long before the event became obvious. The brain tolerated it temporarily until one small, additional change pushed the system beyond its limit. Understanding this helps explain why prevention matters far more than reacting after severe symptoms appear. The body usually provides multiple opportunities to intervene earlier. If warning symptoms have already occurred, even briefly, the goal becomes identifying the mechanism before a larger event develops. This often involves several important medical evaluations. Duplex ultrasound scans of the carotid arteries can reveal narrowing or unstable plaque in the neck vessels feeding the brain. Blood tests like glycated hemoglobin, also called HbA1c, help uncover chronic blood sugar damage even when daily glucose readings appear normal. Heart rhythm monitoring can identify intermittent atrial fibrillation that may only appear occasionally but still generate dangerous clots. Brain imaging helps physicians distinguish between temporary ischemia and bleeding risk. This is also why self-treatment can become dangerous. Many people assume aspirin is automatically helpful during neurological symptoms, but without imaging, nobody knows whether the event involves blocked circulation or bleeding. Blood thinners may help one type of stroke while worsening another catastrophically. Fast medical assessment matters because correct treatment depends entirely on identifying the exact mechanism involved. One of the most dangerous psychological traps surrounding TIAs is the illusion of safety after symptoms disappear. Someone experiences brief numbness, then feels normal again. A week later, speech briefly changes. Then another episode happens days later involving balance. This gradual escalation pattern is extremely common. The body is not being dramatic, it is escalating warnings. The blood vessels are becoming increasingly unstable, yet many people say nothing because each episode resolves temporarily. This silence is what turns preventable vascular disease into devastating stroke later. Temporary symptoms should often be considered more suspicious, not less, because they suggest circulation failed briefly and then partially recovered. The vessel reopened temporarily, but the underlying instability remains active. Now, to be absolutely clear, not every dizzy spell is stroke, not every headache is vascular disaster, not every numb hand represents brain injury. The goal is not paranoia, the goal is discrimination, recognizing the specific combination of sudden onset, one-sided changes, speech difficulty, visual loss, or coordination failure. That pattern deserves respect, especially in individuals with risk factors like diabetes, smoking history, hypertension, atrial fibrillation, obesity, poor sleep, or known arterial plaque. Prevention does not require living in fear. It requires paying attention to how symptoms behave. Sudden, one-sided, strange, new, those are the clues that matter most. So here is the most important message I want you to remember after everything we've discussed. Stroke is often not a surprise. It is the final scene of a process that has been developing silently for years, whispering warnings for days, then shouting for minutes before permanent injury arrives. Your job is to hear the whisper. Temporary vision loss in one eye, sudden one-sided numbness, sudden loss of balance, sudden speech changes, new severe neurological headaches. These are not symptoms to negotiate with, they are symptoms to respect, because if the warning phase is recognized early enough, there is often still time to prevent the larger event from happening. And in stroke prevention, the person who notices early is often the person who avoids the emergency room later. Do not wait for tomorrow. Do not wait for the second episode. Do not wait for dramatic collapse before believing the first quiet warning. Act on the whisper, and you may never have to face the shout.